So, hello everyone, and welcome today. We are marking World AIDS Day with a really important conversation. I am honored to be joined by Professor Massimo Ciccozzi, one of Europe's leading experts on molecular epidemiology, HIV surveillance systems, and infectious disease evolution. Professor Ciccozzi has served on the World Health Organization as an expert consultant for HIV surveillance in Serbia and Montenegro, a scientific lead in HIV molecular epidemiology projects in China, Balkans, Egypt, Italy, and Bulgaria, a PI and contributor to numerous international HIV and infectious disease programs, author of up to more than 600 international publications, including extensive research on the evolution of HIV. And Professor Ciccozzi is also an appointed officer of the Republic of Italy and recent recipient of multiple national and international awards for public health contributions. So thank you so much for joining me today, Professor Ciccozzi. Is there anything I left out that we should know to know you better?
Thank you. Good morning. And thank you to you to invite me in this conversation, not discussion, but conversation, friendly conversation to better explain what's happening in HIV today, because sometimes people don't speak more about HIV. I don't know why. It's like a neglected disease. It's not neglected, of course, but look like something like neglected disease. And this is not true, not good, because people tend to don't have a low guard. It's important that to maintain the situation as a problematic situation. HIV is continuing infecting people continuously. Young people. In Italy, for example, the maximum incidence is more or less in a class of age between 25 to 35, 40, in this range of age. And there is also a delay in go to the test.
Yeah.
If you have delay to going in the test, HIV is an important disease. The cure probably do not make you effect, or better, make effect, but in delay.
Yeah.
And this is not good.
Even just preparing for this interview today, I was, trying to read a bit and just to be prepared to speak with you. And I realized how outdated my own knowledge is, and then I was thinking, well, when was the last time I was speaking about this stuff? Probably in biology class in high school, right? And so I know that you work in the university, and so of course you're in these topics every day and you're learning about these things as they evolve. But for those of us where the education stopped there, where are we supposed to get this? And that's why I'm so grateful we can do this, because we can provide our employees with this knowledge to further our learning. What does science tell us about HIV today compared to about 20 or 30 years ago? Just take us to this jump of how we used to speak about HIV then and AIDS and how we speak about it now.
Very good question, Tanya. Thanks for this question. We are in 2035. In these years, also the last year, maybe in the last 5 years, is better. HIV/AIDS situation is slightly complex, because in one end, we have a therapeutic advance that allow for longer and higher quality of life for those living with the virus, of course. But on the other, new challenges persist, such as the increase in sexual transmitted. People don't use condom, for example, and the risk also of chronic disease, because sometimes cancer and cardiovascular disease are a problem for people that living in HIV and living with HIV from 10, 20 years. probably this is another important situation. Science today view HIV as a manageable chronic infection. This is true because the advanced therapeutic chronicize the disease, and we'll have to consider HIV infection as a manageable chronic infection, as a chronic disease, no longer a death sentence, and this is thanks to the modern drug treatments. If you think that 20, 30 years ago, when this disease was fatal in few months.
Right.
The problem, sorry.
No, right.
In few words, 20, 30 years ago, HIV was often fatal without effective treatment. 20, 30 years ago, treatment drugs with heavy side effects and complex treatment regimen. The quality of life was difficult. Was marked by the illness and the premature death.
Right.
The transmission increased risk also due to the lack of effective drugs for viral suppression, and increased awareness was in 20, 30 years ago, and the stigma at the beginning of the epidemic, or better, pandemic, stigma was very, 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 very high. And also today there is a stigma in certain region, but 20, 30 years ago at the beginning, stigma was very high. Today we can manage HIV disease as a chronic infection with an expectancy of life that is very high. Modern drugs are effective, are tolerated, better tolerated, and the treatment can be prolonged. And prolonged means that you have an expectancy of life very, very, very high. And HIV positive people today are considered as a normal, more or less normal people. Can work, can have a relationship, can have a family, can have children. 20, 30 years ago was incredible to say that. Sorry.
Yeah, no, and thinking, of how I would imagine somebody aging with HIV 20 years ago, right? I would not have imagined the life you painted, right? Abundance, a family, growing old, right? And somehow this is not the image that comes to my mind, right? And now that is the case, but, we didn't.
No. Yes, this is the situation today in respect to 20, 30 years ago. Only one thing persists: stigma. But stigma is probably due to misinformation, not because science tell you there is because HIV is very, very dangerous. No. On the contrary, science write and tell you, don't worry, it's a chronic. Now you have to consider the HIV infection as a chronic disease, not less than chronic disease. But stigma in certain regions, in certain countries,
persists.
But
so on that note, what are the most common misunderstandings about how HIV is transmitted, and what's the scientific reality? Just to set the record straight, can you?
In respect to?
How from your experience in global health, how from what we know now, what is the scientific reality of how HIV is transmitted?
But there is a common misconception about HIV. This misconception can include transmission. For example, some people believe today, unfortunately, not in certain countries, not in Europe less than, but in certain country about HIV, people think that can be transmitted by kissing or by casual contact. This is a false. And also can be transmitted through saliva, urine, sweat, or tears. No, absolutely no. Only infected bodily fluids, blood, semen, vaginal secretion, breast milk. But only in this way can be transmitted. Also, if you have an unprotected sex, not with the usual partner, but occasional sex, unprotected, or you have the usual needle sharing, probably there is a transmission, probably due to have to avoid this fact. But, for example, it's important to understand that the breast milk, not breastfeeding, but breast milk can be transport the virus to from the mother to the children. This is a probably. Transmission, for example, if precaution, sometimes I have read in a journal, in a normal journal, in the time of December, when there is a World Day AIDS. Well, doesn't occur, the transmission doesn't occur if precaution, such as the contraceptive pill or coitus interruptus, are used. This is a false. This is a false. I have read on the journal, coitus interruptus. It's crazy. Crazy. Only condoms can prevent HIV transmission. Only condoms. And the contraceptive pill offers no protection. Absolutely. This is a false. This is important to underline.
Of course. That's incredible. I hadn't heard that one. So what you were mentioning before, now we know that the modern treatment means that people with HIV, they can live long, healthy lives, right? And they can prevent transmission entirely, as you said, through condoms. So could you explain what undetectable and untransmittable means and why that matters?
Yes, of course. To scientific terms.
Yes.
Undetectable is equal to not transmissible. Means that if the HIV virus cannot be detected, undetectable means that with my analysis, I don't relieve, non-detect the virus in a person's blood. Undetectable the viral load means that the virus cannot be sexually transmitted. This is important. This is important because people that normally live with HIV can have a relationship without fear or infection. And we have to reduce the stigma in this procedure. If you have a normal relationship with your normal partner, your solid partner, not casual partner, but solid and normal partner, absolutely. If you have undetectable viruses in your blood analysis, this means that you can transmit the virus. This is important. This is the concept of undetectable. Undetectable means that the virus is suppressed by the therapy. And the level of the presence of the virus is so low that in the blood cannot be detected by the analysis. And if I can detect, is non-detectable in my analysis, is not transmissible. The viral load is so low that it's impossible for the people to transmit the virus through sexual intercourse. This is important concept.
Very interesting. I didn't know this. So now I want to step back a bit globally, understanding that you've had all this experience on HIV surveillance and research around the world, and you've seen these different approaches, right? So what can you tell me about how different countries approach HIV prevention and support? I imagine they have different levels of awareness, different approaches that they use based on the local resources and culture, maybe. So can you tell me a bit about that? Maybe some stories that come to mind?
Yeah. Well, normally in each country, the program on HIV prevention are commonly shared. At least in Europe, it is like this. Other countries, the prevention for HIV, approach the HIV prevention and support through a mix of integrated healthcare, target prevention program, strong national strategies also. But it's slightly different by country to country. For example, in Balkan countries, the perception of the problem was different, was slightly low in respect to Italy when I was in this country. But now are absolutely, the surveillance system for HIV are absolutely very, very, very good in the Balkan countries. In Balkan countries means Serbia, Montenegro, Bulgaria, Albania, all these countries. Probably something different can be in a certain region of Africa, for example, because all the prevention program in these countries are very, very, how to say, difficult to apply. Difficult to apply for the government, for words. Don't forget that in certain region of the Africa, there are wars, internal wars. Internal wars probably take the application of the programs on HIV prevention, of course, very difficult to do. This is only the difference that I have found in my research when I travel all over the world. For example, in China, the surveillance system are very good. I don't say nothing about North Europe, are very good. Very, very similar and very good because WHO, how to say, organize the programs equal for each nation that is into the WHO. For this reason, all the nations have the same program, same prevention program. And I repeat, all in certain African region, I have find differences, but because the war is absolutely a tragedy for everything, also for the application of the surveillance, I don't say that, but application of program to prevent each kind of disease. You can imagine HIV.
Yeah. And just out of curiosity, would you say that the stigma also applies to medical professionals as much? I mean,
to be honest, stigma is not concluded. Seems incredible to say that because there is a therapy, there is a program, the use of condom, blah blah blah. how many program, how many publicity we have done, talking about radio, TV, channel, PC channel, and social, and like this. But if you remember the problematic of monkeypox that was sexually transmitted, there was a stigma at the beginning. Only with men that have sex with men. It's not true. Also, with men with sex with women. If you're having sex, you can have the monkeypox. And I have seen the stigma also in this case. So mean that normally the stigma exists. Sometimes correct, sometimes no. It depends.
Yeah, we spoke to a psychologist who also worked in AIDS awareness in Africa, and she was telling us, for example, one of the stigmas was that if having sex at all gets you AIDS.
Yeah.
So if they got to that level, then when they saw a young woman pregnant in the village, they would say she had AIDS because she's having sex, right? So then you would immediately make these connections.
I believe that is in the mind of the man, in the mind of the human. You have a stigma for everything you can't control or you have against this idea. This is a stigma.
Yeah, then you find ways to explain it, no?
We have inside our body, inside our mind, because we are human.
Right. And that's why we have scientific knowledge, right?
Yes.
To guide us, but to get to it sometimes feels a little bit inaccessible, maybe.
Absolutely. I absolutely agree with you.
Well, thank you so much, Professor. This has been really amazing, and I'm really grateful that we can share this with our employees, and appreciate so much the work you do and how important this is. And I hope we've made all of this information a little bit more accessible to help reduce stigma and around HIV and AIDS.